Good morning, and welcome again to Opposition Rebuttal Table. I'm your host, Kawana Allen, and today we are addressing some comments on our blog. Some of our viewers believe parents should be allowed to withdraw medical care. But before we address, let me reintroduce you to our guests. We have Dr. Sellers, analyst from Washington University, Dr. Allegary from Mercer University, and Dr. Rez, psychologist from Emory University. Welcome, guests, and now let's get started. We have a lot of rebuttal statements which our viewers expressed. One person wrote, parents are motivated by their children's best interests. Dr. Sellers, would you like to respond?
Sure. According to an article by Dalio Kipper, even if this were true, this does not mean that the healthcare providers are not also motivated by the best interest of their patients. Parents may be well motivated, but do not have the same knowledge and experiences as physicians and nurses. Therefore, parents can become confused about what are the best interests for the child. Parents may also be torn between the best interests of the sick child and the best interests of the other family members or of another child.
Okay, great response. We have another argument for a parent's rights to withdraw care is that parents care deeply about the welfare of their child and know who they are and what's their needs. Dr. Sylvia, would you like to respond to this, viewers?
Yes. While it is true that a parent would know their child's ability to endure pain and suffering, according to Kipper, the same emotional bond that allows parents to judge their children's capacity to endure treatment could also make parents place a higher value on avoiding the current suffering without regard to the future benefit to the child.
Okay, sounds great. All right, the last argument stated was that not only does the child endure the consequences of healthcare treatment, but also the parents must endure this burden. Dr. Shannon, what's your response?
My response is that while the burden borne by parents and families is an important consideration in treatment decisions, after all, this is why healthcare providers involve parents in treatment decisions and why they provide support to families in order to relieve the burden of care that they endure as much as possible. If you were to imagine a case where the burden to provide post-treatment care was extreme, but that the child, having received the treatment, had a good chance of cure, then the parent's burden seems less important.
Okay. Well, there you have it. Our panel has voiced their response, and this will conclude our debate. Thank you for watching.